In America, many health concerns can increase a person's risk of death. A human heart is essential in providing blood and oxygen to all of the body's organs. This necessity is why cardiovascular disease should be addressed with my healthcare policy and increased tobacco tax. In Texas, cardiovascular disease has a prevalence of 9%, very close to the United States of 9.1%. There was a noticeable decline in death rates from cardiovascular disease from the 1970s and 2010s. However, even before the COVID 19 pandemic, those rates have maintained steady, with a trend reversal when we analyze certain demographic groups. If Texans make healthier life decisions, we can predict a decline in cardiovascular death rates. There are uneven rates of cardiovascular disease based on race, age, sex, and ethnicity. Tobacco products can strongly affect the health of your heart and blood vessels. If a person smokes, dips, or uses other forms of nicotine, the chemicals enter the bloodstream where they can start to cause damage and inflammation. This damage can lead to problems like atherosclerosis from plaque building up in your arteries. As soon as a person smokes a tobacco product, the amount of oxygen the red blood cells can carry is decreased because of the increased carbon monoxide. This then leads to an increase in cholesterol buildup in the arteries. Nicotine is highly addictive and is within most of your tobacco products and also e cigarettes. When used, it also causes hardening and narrowing of the arteries, blood pressure, and heart rate increase. Once tobacco products, like cigars, start taking a toll on the body, stroke, atrial fibrillation, and heart failure are at higher risk. Also, smokeless tobacco increases the risk of heart attack and death from coronary heart disease. When studies are performed on those who use a pipe for tobacco or smokeless tobacco without cigarette use, there is an association with a higher risk of many cardiovascular diseases when compared to non tobacco users. Tobacco use is not the only controllable factor in cardiovascular disease. Sugar intake and exercise are also within a person's control and can affect heart health. Eating right and exercising can give you a healthier heart as you age. However, what if you already are having heart issues? Can exercise help? For many people, that answer is yes. Doing physical activities has many physiological benefits for your heart. Because of this, it can not only prevent but undo any damage previously caused to the heart and blood vessels. The journal Circulation published a study in September 2021 that showed that those who exercised for a year improved their heart health. The people in this study had left ventricle hypertrophy, the thickening of the left heart chamber. People with this condition have trouble pumping blood efficiently. It was also observed that the study subjects had certain chemicals in their blood that indicated heart injury or a possible increase in risk for heart failure. People with these conditions often go on to develop a particular type of heart failure called heart failure with preserved ejection fraction. The research was done on a small group of people, 46 between the ages of 45 and 64. They were randomly assigned a high intensity exercise or control group for yoga, balance training, and light resistance exercises. All of those who participated in the program underwent heart imaging and tests to properly evaluate their improvements in heart muscle flexibility at the beginning and end of the trial training programs. After a year of training, the researchers found that the people's hearts had become less rigid and more efficient at pumping blood than those of the control group members. Although they saw improvements with 1 year of exercise, they concluded that more time was needed to assess the situation appropriately. With all of those various ways cardiovascular health is negatively affected, we must choose a way to improve heart health for Texans. A utilitarian approach is always best. If we look at tobacco usage and how tax has added benefit of revenue for other programs, increasing this tax is a win win situation. A rather significant increase in tobacco product taxes will result in even fewer kids starting to smoke. With the additional benefit of more adults quitting, In addition, as mentioned earlier, the additional benefit of revenue generated can be used for health and tobacco prevention programs. A mere 10% increases in tobacco tax reduces consumption by roughly 4% among adults and 7% for children. From the federal level, revenue from cigarettes and tobacco taxes help fund programs that support children and adults across the country. This includes programs like the Children's Health Insurance Program, CHIP. CHIP is used to provide health insurance to many children in the United States who would be uninsured without it. Tobacco tax on the federal level was last increased in 2009 by 62 cents per pack, and the federal cigarette tax was $1.01 per pack. Revenue from state and local tobacco taxes can be used to fund state tobacco control programs. 49 states and the District of Columbia have increased their cigarette tax since 2002, with the average state cigarette tax being $1.93 per pack as of January 1st, 2024. Tobacco usage, as we know, is a killer of roughly 8 million people a year, and globally is the leading cause of preventable deaths. With all the evidence in history of tobacco excise taxes, we see how it can benefit our society. Treatment for heart disease hurts healthcare costs as well. Implementing preventative measures such as lifestyle changes and early interventions has the potential to alleviate some of the economic burden on healthcare systems and individuals. Burnout is another issue healthcare clinicians have. The coronavirus disease of 2019 presented the world healthcare systems a new and unanticipated obstacle. During the pandemic, healthcare modalities encountered issues with limited expert staff availability and the possibility of perioprocedural transmission of the virus between patients and staff. The leadership of healthcare workers had to act quickly to restructure and deliver key resources. A recent study conducted in the Middle East found that the healthcare professionals experienced psychological stress during the outbreak. An issue like this can lead to physician burnout, a significant problem already in healthcare. By increasing tobacco tax and decreasing the number of new and old users, we can help medical clinicians by alleviating some of their workload stress and allowing them to concentrate on other efforts. The process may be complicated for a bill on the tobacco tax increase to become law. Tobacco companies are opponents to such laws, and politicians will need to be convinced that it is in the people's best interest. The arguments against raising tobacco taxes often emphasize the severe economic strain these measures place on low-income families by pointing out that tax increases worsen financial difficulties for already vulnerable groups. Several critics argue that increasing tobacco taxes represents a regressive policy because it extracts a higher proportion of income from low-income smokers compared to wealthier individuals, which results in the exacerbation of economic inequality. This stresses that smoking rates remain elevated among lower socioeconomic groups, which results in these families shouldering the majority of increased costs without seeing a corresponding decrease in their tobacco consumption. As a direct result, in their stance, critics claim that increased taxation causes low-income smokers to experience heightened financial pressure because they spend a larger portion of their restricted funds on tobacco products instead of essential goods and services. The tax has provided a health win by decreasing illness like cardiovascular disease in non-smokers. The tax increase is one of the most effective ways to decrease smoking and tobacco usage, especially among the youth. Revenue increases have benefited every state, significantly increasing its cigarette tax and reducing smoking. Tax increases also save states money on healthcare by reducing tobacco-related costs, including Medicaid expenses. States also see greater health benefits and cost savings by allocating some of the revenue to programs that prevent you from smoking and help smokers quit. Last is support for politicians. Both national and state polls have shown high public support for tobacco tax increases. In addition, polls have also shown that when it comes to achieving a balanced budget, voters prefer raising tobacco taxes to other tax increases. This is favored over cutting crucial programs like education and public safety. Over the next 5 years, if this bill is made law, we will start to see decreases in smoking caused heart attacks and strokes, fewer smoking affected pregnancies and related birth complications, in addition to fewer lung cancer cases. Implementing higher tobacco taxes produces significant economic advantages for local communities by channeling financial resources into community developing projects while decreasing the economic strain caused by tobacco related diseases. The occurrence of chronic diseases, including cancer, cardiovascular disease, and respiratory illness in local healthcare systems, decreases when tobacco consumption drops because of increased prices. Decreased patient load helps medical facilities experience less strain, enabling healthcare professionals to distribute their resources with greater efficiency, resulting in enhanced service quality across the board. As a result of advancements in public health systems, communities have experienced improved healthcare facilities and decreased medical costs. The financial benefits obtained through elevated tobacco taxes creates additional government income which can be directed toward local initiatives to boost economic development and enhance social welfare programs. The financial resource provided by these funds commonly back a range of educational initiatives, smoking cessation programs, and other public health campaigns that work together to decrease smoking prevalence while advancing healthier lifestyle choices. The economic benefits of reduced tobacco consumption surpass mere health related savings because decreased tobacco use leads to enhanced workplace productivity. Individuals who smoke tobacco products tend to show higher rates of work absence due to illness or diminished work performance because of diseases caused by smoking. The decline in smoking rates due to tax increases leads employers to experience the advantages of having a healthier workforce, which results in reduced absenteeism and enhanced productivity levels. The enhancement benefits local business through heightened production levels while decreasing expenses linked to employee health insurance claims. The financial stability of families belonging to these communities sees enhancement because they spend fewer resources on tobacco products and medical costs related to smoking diseases. Thank you.